like to thank my dear mentor and colleague, Dr. David Pelkovitz, for introducing me to Vayichan, and to Rabbi Reuben Targan for his tireless efforts in bringing this amazing program to Klal Yisrael. Full disclosure, I am not a chief rabbi, I'm not a Rosh Yeshiva, I'm not a distinguished rabbinic educator, I'm also not a tour guide. I am a clinical scientist and a mental health professional who studies and helps people struggling with concerns like depression and anxiety and stress. So I hesitated when Dr. Pelkovitz asked me to participate in this amazing program. What am I going to add to a discussion about Ahavas Yisrael? I value and I love helping my fellow Jews, but what does mental health have to do with this important topic? And I thought about it. And the year is Tafshin Pei. Some might say it's an acronym for Tehei Shnas Pella. It's been an extraordinary year. Everybody can agree. And given the most unusual circumstances of Tafshin Pei, there's never been a greater need for mental health support. And in the context of that pressing, even dire need for mental health support, there's also never been a greater need, or maybe there's never been a greater opportunity for Ahavas Yisrael. So therefore, I do have something to say. I'd like to share some thoughts about Ahavas Yisrael, specifically in the era of anxiety that we're living in. To start with some information about mental health, and then at the end to discuss what does Ahavas Yisrael have to do with it. So for the past several years, long before COVID-19 and other crises we're facing, anxiety has been on the rise in a very dramatic way. Prior to the coronavirus, according to the American National Institute of Mental Health, nearly 1 in 5 adults every year has a full-blown anxiety disorder, and over the lifetime it's 2 in 5, 40% of the population. Depression isn't quite as common, but it still impacts 1 in 10 American adults every year, and 1 in 5 women has a depressive episode over the lifespan, 1 in 5. Internationally, the World Health Organization estimates that 3.5% of all human beings are clinically depressed at any time. But even more concerning is the severity. The severity of mental health is becoming very, very problematic. About a quarter of individuals who struggle with mental health have severe symptoms, and that means that they're incapacitated or potentially worse. Depression is the #1 leading cause of disability among individuals under age 45. That means that they cannot function day to day, and that means that depression has more functional impairment than terminal stage cancer. Along these lines, in the United States, suicide is the 2nd leading cause of death among individuals under age 35. In fact, more young people die from suicide today than cancer, heart disease, stroke, AIDS, birth defects, influenza, and chronic lung disease combined, if you combine all of those. And the United States suicide rates are only 27th internationally. Russia, most of Eastern Europe, many Western European countries are worse, and locations such as Germany, Canada, and South Africa are not that far behind. Israel is significantly less. It's about 1/3 of the United States. And the UK is about halfway between Israel and the United States in terms of suicide. In the Jewish world, my colleague Tzvi Piratinsky and I have published more than 20 papers, scientific papers on mental health issues in the community, and we have found that Orthodox Jews tend to fare somewhat better than non-Orthodox counterparts on indices of mental health. But there's still a lot of cause for concern. We recently did a study with over 400 individuals from the United States and Canada, Jewish individuals. Two-fifths of Orthodox Jews screened positive for a diagnosis. That's 40%. And 21% of Orthodox Jews were currently taking psychiatric medications. So our best estimate are that between 1/5 and 2/5 of Orthodox Jewish adults today have some sort of a diagnosable mental disorder. And that is consistent with other things that I've seen. And all of that was before COVID. Now, our society is completely unmoored, panic-stricken, obsessed with fear. My clinical office, called the Center for Anxiety in New York, we've been inundated with calls from around the globe. Cases are more severe than ever. People are completely stressed out, overwhelmed, isolated, alone, and scared. Many people have lost loved ones. Many people have lost their jobs. We have children who have been lost weeks and months of school. Sleep patterns are altered. We have access to medical care has been reduced. People who have chronic health conditions, that's a very significant stress for them. We have evidence of increased use of tobacco, alcohol, and substances, and many marriages have become strained, if not outright endangered. All of these are very, very significant, but when you step back and consider the broader context, there is an important question that emerges. In decades past, our emotional and behavioral approaches, they were not as extreme, even during times of war. During the Cuban Missile Crisis, which was not quite a war, but it literally brought the world to the brink of nuclear war, stress was extremely high, but it wasn't like what we're seeing today. Even after the terrorist attacks of September 11, 2001, there was a sense of tension and there was a sense of sadness and loss, but the rawness of our emotions today is so much more acute. Now, Baruch Hashem, I was not alive during the Holocaust, during the Shoah, and I also did not witness any of Israel's major wars. But my sense from reading through the history books is that we used to be a lot more resilient than we are today. Times of crisis, they created opportunities and we would show our resilience and our strength and our conviction and our connection with each other. But today, that's not what's happening. To make the contrast a little bit more stark, coronavirus is a deadly pandemic, and it is definitely worthy of concern. But let's be very clear, the vast majority of people are not getting infected. Even in places like Sweden, which have taken very few precautions, the majority of people who are infected, they're not developing COVID-19, the real problem. And the vast majority of COVID-19 patients are not receiving hospital-level care, or they don't need it. And the majority of those who do become hospitalized, they end up surviving. So given the context, perhaps the most novel thing about the coronavirus is that it has exposed our underlying vulnerability to emotional distress. So that raises a very important question, which is why are we so anxious compared to what used to be? And fortunately, clinical science does have an answer. In a nutshell, anxiety comes from the inability to tolerate situations that are uncontrollable and uncertain. When people can't handle having a lack of agency, having a lack of information, they are more likely to experience anxiety. The more we need to feel in control, the more anxious we will be. And today, our general culture is obsessed with feeling like we're in control. We have predictions for almost everything: financial markets, political elections, the weather, and we all know that the predictions are almost always wrong, but we scrutinize them tens, sometimes hundreds of times a day because we cannot tolerate uncertainty. We prefer to predict the future and to be dead wrong than to admit that we don't know what's going to happen next. And the cultural need for control is also apparent in our avoidance of pain and discomfort. Worldwide sales of over-the-counter analgesics like Tylenol, Advil, aspirin, and the like is over $24 billion per year. That's an incredible sum of funds, more than the entire economy of Iceland, which ranks about 100th worldwide in terms of global economies. We are dead set on avoiding pain. Why? Because when we feel uncomfortable, it reminds us we're not in control. What makes us truly anxious, though, is the fact that we are allergic to our emotions. We're actually allergic to feeling distressed, and that makes us feel even more distressed. Today, normal mood fluctuations, things that used to be considered completely normal, are perceived as a weakness. They're perceived as something to be avoided. They're perceived as an indication that we are not in control. And they are seen as something that we have to fear. And our culture values the avoidance and suppression of emotions as opposed to just letting it be. We medicalize mood states. The first reaction people have is to call it a chemical, biological problem and to try to medicate it away. And we expect our emotions to be even-keeled, to be in check all the time, and when we don't feel that way, and when others don't feel that way, we label them as ill. Unfortunately, this reaction actually makes it worse. When we can't accept how we feel, our emotions get worse. Years ago, during my clinical training, I worked in an anxiety clinic, a world-renowned anxiety clinic, and they did a very famous experiment. They showed very upsetting videos to participants, and then they randomized those participants into two groups. The first group was told, erase any thoughts, any feelings about the video, erase it from your minds. Get it out, block it out, make sure that you don't think about it. And the second group was told to accept those thoughts and those feelings, to just let the thoughts be in their mind, not to control it, and just to let them be there. Take a guess, which group felt better after 30 minutes, and then again a week later? It was the second group. They were much better off. When we accept, when we let go, then our distress dissipates. And that's why we're struggling today. We are getting a message very loud and clear that we need to let go. The reality is that life is a lot less controllable and less certain than most people in the Western industrialized world realize today. If you just take your hand and you wave your fingers, you can see there are so many physiological, biological, neurological, chemical, other processes, and they all have to work precisely in order for you to do this. And how many of those are in our control? Well, they're not in my control. And if that's the case for a simple activity, then imagine things that are more complicated, like playing piano or speaking to people or having conversations, anything that we do. Furthermore, every major facet of our lives that shapes our experience is almost completely beyond our control. How many people chose when, where, and whether to be born, or their parents, or economic circumstances, or social circumstances, or the time period in history in which we live? The more we think about it, the clearer it becomes. We have virtually no control about the most important aspects of our lives. And we live in this privileged and technologically advanced world that makes us forget that simple fact that we're just not in control. COVID-19 is the reality that we are not in control hitting us over the head. That's what it is. The truth is, we've been at risk for viral outbreaks for decades. We might not like to think about it, but we're also vulnerable to a lot of other issues. In truth, it's miraculous that such events don't occur more frequently in the current era. And this crisis is calling upon us to accept that there are limits to what we can know, there are limits to what we control. That is the nature of being a human being. It's time to practice that humility and make peace with it. To accept our uncertainty, to accept the fact that safety is an illusion, and once we understand and can make peace with that, with our inherent vulnerability, then we can have the strength to move forward. In my clinic, we have a technique to help people overcome that sense, overcome their anxiety by practicing acceptance that they are not in control. The technique is called exposure therapy, and the way it works is by encouraging people to face their fears head on until they come to a place of acceptance. Years ago, I had a rabbi friend actually, who confided in me. He said he had a fear of heights. So he said, what should I do? So I said, I know exactly what you have to do if you want to overcome your fear of heights. Go up to the highest point you can think of with a straight view all the way down, hundreds of feet, behind a bar, of course, nothing dangerous, and peer over the edge of that bar as long as it takes for your anxiety to naturally go away. And he looked at me as if I was crazy. He said, why would I want to do that? What if I have a panic attack? So I said, well, if you want to overcome your fear of anxiety, that's the only reliable method that I know of. Go up there, panic, completely let go, and let your panic symptoms just wash over you. Don't fight them. And he looked at me and he said, you are crazy. So a year later, I got an email from him saying that he had just come back from a trip to San Francisco, and he took this opportunity and he faced his fears. He traversed the entire Golden Gate Bridge on foot. He was looking over the side rail. He said he was shaking. He thought he was going to throw up. He was panicking like he had never panicked before. And at the end, he had this wonderful sense of peace because he stood up to his anxiety. In other cases, even when the anxiety is very complicated, much more than a specific phobia, we take the same approach. When patients have OCD, we encourage them, obsessive compulsive disorder, we encourage them to face their fears and to not engage in their compulsions, even if they're very complicated. For panic disorder, we have many ways in our office to trigger a panic attack, and the goal is to help people to accept as opposed to suppressing how they feel. For social anxiety, we encourage people to face their fears, go beyond their comfort zone, and take a risk that other people might judge them. And worrywurts, we encourage them really to think the worst until they can accept the reality that worrying, it doesn't lead to greater control of life. In all of these and other examples, the method is pretty simple. We're helping people to embrace the unknown, to give up control, to accept that their emotions will at times get the better of them and to be okay with it. And the methods that we have are very effective. At my program, 97% of patients have significant reductions in anxiety by the end of treatment. And for 80% of patients with mild to moderate symptoms, that happens after just 7 sessions. Okay, what does this have to do with Ahavas Yisrael? Well, first, we must recognize that tension and anxiety today are very high. The numbers I shared with you before are staggering. People are truly suffering. People are stressed to the max, concerns about finances, children, marriages, and much more. And we have to have compassion, giving other people the benefit of the doubt and being very, very, very kind. I consult a little bit for the United States government and the Health and Human Services Division. And there's a comment that's often said when I go to Washington, which is that depression is called the no casserole disease. Because when people get cancer, God forbid, or if they have surgery, then their neighbors show up with a lasagna at their door. They have a casserole. But when people get depressed, their neighbors run away. Individuals who are struggling with emotional needs, they need more support, not less. But typically, we don't offer support when people are struggling emotionally. And we need to do so. That is Ahavas Yisrael at its finest. Second, the root of anxiety is a need for control and knowledge. Now, as a clinician, it is perfectly fine for me to help my patients to overcome that need through exposure therapy. I want to help them to accept their lack of control. That's what they're paying me to do. But as a community member, I have to take a very different tact. As community members, we do chesed with people. We validate, we appreciate their need for control. Validation is gold today. It is a critical technique. It involves conveying to other people that their feelings make sense, even if we don't agree with them, and listening to what they're saying, the emotions behind those words, and showing that we understand how they feel. And along these lines, we need to appreciate that most people have a genuine emotional need today for clear, timely, and accurate communication, especially about community or other matters. There's a need for greater transparency and clarity and discussion and patience and engagement, and ignoring or shutting down difficult conversations. It's very painful and very destructive for parties today in the era of anxiety. And third and finally, the time has come to end mental health stigma. There is nothing worse for someone when they're feeling anxious or depressed than to feel judged by others for feeling anxious or depressed. There's nothing worse. When people feel stigma, they don't share their feelings, and they ignore them, and they suppress them, and that makes the whole situation worse. Unfortunately, I have many stories from years of work of educators, community leaders, and others who have judged and criticized and even discriminated against those with mental health struggles. In many cases, people were well-meaning. They were trying to get others back on their feet. But stigma is so unbelievably destructive when it comes to mental health. To those who are suffering, it's a simple message. Join the club. There is nothing to be ashamed of or embarrassed of today. And hiding or ignoring how we feel, it just makes it worse. And we have to send that message to others. And if you're not in the category of people who are suffering, then Hashem should bless you. Please understand that the majority of people today are struggling. Or at least they have somebody in their families who are struggling. And judgment, stigma, shunning, and the like, they're not only are they not helpful, they're extremely destructive. So in sum, we are living in an era of anxiety. There has never been a greater need for emotional support, and because of that, there has never been a greater need to love each other for Ahavas Yisrael. Thank you.